Welcome back. We were talking to the Professor Sajjadur Rahman about various aspects of health and health facilities. Going back to Dhaka, Professor Sajjad, you have an enormous amount of experience working here in the UK, working in the Middle East, working in Bangladesh, be appointed as a professor of surgery. You have also been associated with what was called the Postgraduate Research Center or Postgraduate Medical Center, isn't it? At
Postgraduate Medical Center.
Which is now Bangabandhu
University.
Sheikh Mujibur Rahman Medical Center, yes. How is, over these years, how have the health facilities developed, or are they up to scratch? I mean, the population is increasing. We have about 160 million, and it's also going up all the time.
Yes, population is a big problem, but as you know, initially our health system started from the scratch, and it had to be gradually propped up, and different government at different times have taken up different programs. But this is actually getting some result out of it. Not that we have achieved a great result, but our infant mortality, maternal mortality, we have achieved better than India and some of the Far Eastern countries. Right. And we are in a higher status than a lot of our...
Is it because of good programs, or is it because of good personnel?
It is actually, it is a government program, and as well as globalization of the knowledge and the treatment facilities available. Our doctors are being able to go into the websites and look into the recent developments in the field.
Right.
So this has
the spread of knowledge.
Spread of knowledge has made it a big success, and I must say, I consider the present day doctors know more than what I knew when I was practicing at that age. So this is because
it's only because of this spread of knowledge.
Spread of knowledge. In the past, it used to be books, but now it is, you can get in the web anywhere. What is prevalent in the United States today or UK today, you can see it simultaneously in anywhere where you can get the Wi-Fi system and internet system. You can get the news.
That's very good, you see. There are so many hospitals in Dhaka, and with the increasing population, we also have increasing number of patients. What is it that a lot of people feel like going abroad for treatments, particularly the neighboring country, India?
Yes, I think there is a tendency for people to go abroad, and probably they think they should get a better treatment.
But do they?
There is a question. Some of them do get better treatment. In fact, some of them do get better treatment at home even.
Yes.
But because of more number of patients in our hospitals, doctors in the government sector and in the private sector cannot give enough attention, enough time to the patient. As a result, patient tend to lose confidence in the doctor. And because so many patients, doctor has to, if you go to a private chamber of a doctor, busy doctor, he hardly has a minute or two to give to the patient. So how can he get all the information from the patient? That's why in Prava we have 15-minute slot for every patient.
Good.
So we give enough attention, we listen to the patient, and give them enough time so that they feel happy about communicating properly.
Yeah, these are well-to-do people, you see, who can afford
Well,
to
we have both.
buy 15 minutes. See.
Anyone coming in our door,
Yeah,
he
it's given
gets
15 minutes
15
slot.
minute slots. And we have 3 shifts,
Right.
morning, midday and the evening shifts of doctors, and they come every day.
But you know, there's millions of people who will not probably come to you, but will go to Dhaka Medical College and other government hospitals.
Again,
You see.
their situation is much worse. There they have so many patients.
Yeah.
I was a professor of pediatric surgery in Dhaka Medical College before I retired. And the patient there were so many, we admitted them, and in one bed, although it's not right to say these things, but we used to keep three kids in one bed because there are too many patients.
Right.
And it was not the right way of treating, but I have no other alternative.
But buying a bed should not be a very expensive affair.
Not buying the space.
Yeah.
Hospital, in the room, there are only few beds, 10, 15 beds, 20 beds, and there are 60
I've seen
patients.
pictures of people in the corridor.
Lying on the corridor, lying on the floor.
Yeah.
So this is where so many, our attitude, our tendency is not to say no to the patient. So anyone coming in, if they
that's
require.
very good. That's very good, isn't it?
So then if you say you will not say no to anybody, if you bring in everyone,
But
then
you've got to provide the facilities.
provide the facilities. And of course now probably we'll have better facilities. We have gone from the lower income to middle income group, or we are
Inshallah, we are going to.
inshallah. So maybe we'll be able to provide more and more, but that is not going to be enough. If we have about 20 Dhaka Medical College or PG Hospital, Bangabandhu Medical University.
How many private? We have about 150 or something private
Medical colleges.
Colleges.
I think we have about 100 or plus medical colleges. But
And we have about 16 or 17 government hospitals, is it?
17 government medical colleges. But you see, the problem is we have.
But are we producing enough doctors, paramedics to confront this?
This is where we have a bit of problem. We are trying to produce paramedics, but we don't have enough
facilities.
Sort of, not only facilities, right sort of people to be trained. Now we are trying. You cannot produce overnight a technician or a doctor.
It takes five years to produce a doctor.
4 years.
Doctor, right?
4 years for a technician. Nurse 4 years. Now we don't have enough nurse, enough technicians. But then again, this is tertiary based.
Right.
What we need to do is to go to the primary base. Primary level, we have to give good nutrition, good health care, facilities, not only facilities, information. Information about health. If we can provide to our people good information, then we will reap the benefit later.
Yeah, but as you said that all the information these days is available on Google. So people are more well informed, see, and you go to your Facebook page or any other pages, it's full of, there's a kind of an attack of information. See.
Yes,
everybody's trying to sell something.
Lot of information is coming out, but there are some of them are not the right sort of information. Anybody and everybody cannot advise on health ground unless he or she has.
Right. It's a very important issue that I have in my mind is about you have also performed operations of kidney transplants, see, and that is something very important, and a lot of people ask questions about it. What are the symptoms of a kidney problem, and then how can it be addressed?
Kidney problem actually present in different scenarios. It can be general unwellness, where you don't feel well. You can have recurrent urinary, you have had previously recurrent urinary infection, and that has given rise to high blood pressure. High blood pressure along with your tendency to develop diabetes can give rise to problem with the kidneys. So kidney is the organ which can be hammered from different angles. First is you can take a lot of material, foodstuff which are not helpful to the health of the kidney.
What are those
There are,
in brief?
in brief, there are things that are difficult to pass, like uric acid. Uric acid is something which excuse me, which can cause problems in passing through the tubules of the kidney. Diabetes excuse me, diabetes itself can damage the blood vessels of the kidney, thicken the blood vessels of the kidney. Cholesterol thicken the blood vessel of the kidney, raising the blood pressure. Blood pressure once raised, then it can cause it can have a circular effect.
So there can be various symptoms.
Various symptoms. So usually starts with recurrent urinary tract infections. If not treated properly, then infection can go to the kidney. Then pyelonephritis, pyelitis sort of things. It can damage the kidney in a different way. The tubules of the kidney, where the straining takes place, blood is strained through, the abnormal material or harmful material are excreted. That cannot be excreted if the membrane of the system becomes thickened. Blood pressure goes up.
Is kidney disease specific to any particular areas, particular age?
Kidney disease is not exactly endemic or any sort of special area, but main thing is if people don't drink enough. Lifestyle is very important. Drink must be enough fluid intake so that all the abnormal or toxic material is washed out of the system. You should have a proper healthy lifestyle. You should have a proper healthy food habits. Lot of junk habits are not at all.
Thank you very much on this very nice point.
Thank you, sir.
Avoiding the junk food.
Thank
you very much for being with us. I hope that you have enjoyed the show as much as we have, and thank you very much for being with us. I wanted to share with you that Talking Point is now 7 years old, and thank you for all your support. Bye for now.